All right, we are inside now. We're here with Dr. Royce. How are you, Dr. Royce?
I'm fabulous. How are you?
I am phenomenal now that I'm here at my favorite plastic surgery center.
Wonderful, wonderful. I'm glad you're here.
So what are we doing here today?
Today we are doing Ultra Shape treatments, non-invasive fat reduction,
Wow.
painless, no downtime.
And is that anything like cool sculpting?
It's similar because they're both non-invasive treatments. They're non-surgical treatments.
Okay.
The difference is Ultra Shape uses ultrasound waves, just like, waves that are used for checking mothers with babies.
Right.
So it's similar. And I have a fabulous technician, my sister, Wendy Royce, who does the treatments and is fabulously trained in this. And it permanently breaks up the fat cells and the body metabolizes it. And the bulges start to go away. Right. So it's especially for those patients who just don't want surgery or those who can't have it.
That's me.
For whatever medical reasons.
Right.
This is a great option. It does take at least 3 treatments separated by 2 weeks apart, but it's a painless session. It's a relaxing session. And your body metabolizes the fat cells, the superficial fat cells that are destroyed, and the bulges go down, and you can lose, a good 2 inches in 3 treatments.
Well, let's share with our viewers about cost. What type of fee is it?
And it varies depending on the size of things that are being treated.
How much is needed?
And how much is needed. I mean, but it does vary. It probably ranges on average about $900 to $1,000 a treatment.
Okay.
You need to do at least 3 treatments.
It's still a little cheaper than surgery.
It's much cheaper than surgery, and it's much safer.
Right.
There's certainly no anesthesia.
And no downtime.
There's no downtime, nothing. And there's no tight girdle garments or anything that you have to wear, such as with liposuction. So it's a great option.
Right.
It's a great option.
So what do we got here going on?
So Wendy is doing a treatment today. And Wendy's going to explain a little more about that for us.
All right, what's going on over here, Wendy?
Well, we're giving her a nice treatment right in her mid-abdominal area, helping her reduce her body fat with one little press of a button. And it's that simple.
And how does it feel, Donna?
I don't feel anything.
You don't feel a vibration or anything?
Nothing. There's no feeling at all.
Wow, that's incredible.
Yeah, it's a great tool. It's very, very quick, very simple, and very, very affordable in comparison to some of the other cost-related expenses that occur when you have something more invasive. So this becomes a very valuable tool for her practice as well as for aesthetic reasons, because you really can not have to lose any time at work. You can get right back into the gym. And again, you don't have to wear any uncomfortable garments.
So in essence, it probably pretty much breaks up the fat, and then you kind of pee it out?
Absolutely, yes. And you have to stay properly hydrated and really gear your nutrition, again, according to eating very clean as well, to maximize results. But the results are seen in a 12-week window.
Oh, good.
And there's 0 downtime. You have no pain. There's no scars as a result. In fact, this is actually designed to help reduce any scarring if you have that as well. So it does multi-purposeful things to gear it around being a good fat destructor as well. Yeah. So it's really good. It's really
How does it feel, Donna?
I'm just relaxed. I don't feel anything.
Yeah.
And about how long does the treatment take?
Well, again, it varies on the size. It can be 20 minutes up to 90 minutes, depending on how many areas you'd like to have done at one time. But it's very easy compared to getting up at 6 in the morning, getting ready for surgery. Yeah, that's never fun.
What's that?
It's like
Somebody massaging your belly. That's
it feels like you're doing crunches when you get done.
We are here with Out and About Sarasota and Dr. Royce of Royce Plastic Surgery and Tyler Butler, our patient. Yes. So we're going to talk about Botox because Tyler is going to be receiving some Botox injections and why it's really important, Dr. Royce, of using a board-certified plastic surgeon for this kind of procedure. So what would you tell us about Botox today?
Well, absolutely. Well, first I wanted to mention again that it really is important to have a board-certified plastic and reconstructive surgeon to give you your injections because you really want someone who's fully trained. You want someone that has a certifying agency that oversees their training and understands that, they have been trained appropriately and that they know how to do the procedure that you're interested in.
Absolutely. And I understand there's different kinds of Botox on the market that people might not be aware of, and there's certain things to ask for.
There is. Botox is distributed by Allergan, which is a company here in the United States. There is a cosmetic grade, which you can see on this box. It says cosmetic. There's also a research grade, which is not as purified and really is not supposed to be used in a cosmetic fashion, but it is a cheaper product. There might be some docs who purchase the research grade and sell it off as cosmetic, and that's not safe.
Wow.
So
Some people think by getting a great deal sometimes isn't always a great deal.
sometimes it's not always a great deal. So not only is, you can always ask your doctor, and the doctor should not be concerned or be afraid at all to show you that the Botox you're getting is cosmetic grade, and you want to not only look at the box, but you want to look at the bottle, because
Looks like it's like a purple rimmed bottle.
they all are.
Okay.
But this one, if you look close, has got a hologram. It's iridescent on the white, and it has a hologram, and that's the true cosmetic Botox. The research grade has a flat white label.
Very interesting.
It's very subtle,
Yes.
but you want to get the real stuff.
Absolutely.
It's your face.
Absolutely.
Right, it's your face.
So today we're actually going to be doing some work on Tyler, correct? So Botox is very safe. It can be used for many different areas, not only for cosmetic purposes, but there's some medical benefits as well.
Absolutely, absolutely. Botox is used also. It's FDA approved now for prevention of migraines.
Oh.
And it really works because I suffer with it myself.
So that's why I'm getting it today, for a migraine.
Absolutely.
And
it's sweating.
And
as
it's
well.
used for
Yes.
sweating, for hyperhidrosis, excessive sweating of the armpits. Actually, it takes 100 units, but a one-time treatment lasts a year
Wow.
for excessive sweating.
Wow.
And there are some folks who have to wear suits all day, and it really benefits
Yeah,
them.
especially down here it's so hot.
Absolutely,
Yes.
and it really works.
Wow.
It really works.
Wow.
And it also really works for most folks for prevention of migraines.
Wow.
It can not only be injected in the forehead, it can be injected posterior cervical, trapezius muscles,
Wow.
and it really works.
Wow.
So
That's
it's
fantastic.
a wonderful benefit. Instead of having to take a bunch of medications and narcotics,
Yeah.
you just prevent it with your Botox shot every 3 months.
Wow. Fantastic.
It's a great
That's
alternative.
great to know.
Absolutely.
Terrific.
So, and so I want to mention, so Botox comes actually as a crystalline. This actually was frozen,
Oh, wow.
and you can see it looks like an empty bottle.
Is it cold?
Well, it's a little
Oh,
cold,
right.
But the Botox is actually just right in that rim there.
So
It's
there's
100
no
units.
actual
Wow.
liquid
There's
inside.
no liquid
I
when
thought it was
comes.
liquid.
No.
Oh.
And so, but what's recommended, the Allergan company recommends their docs dilute the Botox with 1 cc of saline, bacteriostatic saline. So,
Okay.
but there are some docs again, or some other these spas or places that might dilute it with more than 1 cc.
Oh.
And so
To
when
get
you-
more out of it.
to get
Right.
more out of it.
Wow.
And so the important thing is it has 100 units in the bottle. So when you go to get Botox, you don't want to know how many cc's you're getting injected with.
Right.
You want to know how many units you're getting.
Interesting.
Mhm.
Wow. That's
Because-
really important.
Very important.
Yes.
You could also you might get 2 cc's, but you also might just get 2 units of Botox in that.
Right, right. Yeah. And there's no sort of monitoring system or anything of that nature.
Nope,
There's no way to know. There's no regulatory.
there is not.
Wow.
That's why you want to go to
a board certified.
certified plastic surgeon,
Yes.
or a board certified, ENT physicians who
Yes.
also do, and they know what they're doing.
Right.
And they are regulated by these other agencies.
Right.
So they
Very
have to do it right.
interesting. Yeah.
And they should do it right.
Yes, absolutely.
So we're going to dilute today this bottle of 100 units with 1 cc of saline. And then we're going to do some injections.
Yay!
Yay!
For my migraines.
Yes!
Yes. And you're sweating.
And my sweating. Yes.
All right. Because we're going to treat, you have a little bit of lines on the forehead.
I never noticed.
Yeah. So we're going to help to just smooth those out. And see when you do angry. No, do angry. See, those are the glabella. These are very strong muscles there. So it just must be your just strong, character.
Yes, the strong
physique.
character.
Yes.
That's it. Yes.
So
I have seen some people get like a droopy eye from doing too low, so that's another reason why you'd want to go to board certified.
absolutely.
Right.
Absolutely. And also, the Botox company recommends for 4 hours afterwards, you want to not get all hot and sweaty. You want to keep your head elevated. You don't want to exercise
Right.
or cook over a hot stove.
No gym, no bending.
For 4 hours.
Right.
Let it set. Let the Botox do its thing. Then you can go about and do your business, do whatever you want to do, and there'll be less likely chances of you getting brow droop or eyelid droop,
Got it.
which would be temporary, but why
Right.
have it? So, and then also see when you smile, see you got these little crow's feet, so we're going to help to soften those too today with Botox.
Migraines.
Okay, so
The needles are very, very small, so there's almost no pain whatsoever. It's just a little teeny prick. They're little teeny
they're insulin
insulin
needles.
needles.
They're
And
insulin
how
needles.
long have you been practicing, Dr. Royce?
I have been practicing since 1999. So
Since you were 12.
since I was 12.
Yes.
Yes. So 18 years.
Wow, has it been that long?
Yeah. So what I'm going to do is take 1 cc of our sterile bacteriostatic saline. Get the bubbles in it. Make sure
That's very interesting. I didn't realize that you have to, it's the saline with the Botox in the crystalline form.
Absolutely.
Yes.
Yeah. So yeah, when we get Botox shipped to us, it's comes in a refrigerated package.
Right.
It has to always be refrigerated or frozen until
Okay.
you reconstitute. And then we're going to reconstitute with 1 cc. And it mixes, very quickly. Now we got liquid.
Oh, wow. Okay.
Now we got liquid.
That's like a couple seconds.
Yeah. And then what I like
Are
to
you nervous?
I'm a little nervous because I've never done anything like this.
I know,
before.
you've never had this before, ever.
All those migraine headaches, and I've never had this done before.
Well, here we go.
And so then what I like to do also, there's a rubber cap here. I like to keep my Botox needles very sharp. So, again, because they hurt less. So actually what I do is I take the metal thingy off and I take the rubber off. And that way I don't have to stick my needle through the rubber and potentially dull the rubber cap a little bit.
Oh, okay.
So, and then we're going to just draw up. And Botox lasts 3 to 4 months. The longer you use it and get injections, the more it maintains.
Now, what about, isn't there another injection that's similar to Botox but lasts like a year or 8 months? Isn't there another type of...
Well, there are other botulism toxins out there, but they don't really last that long.
You might be thinking of Juvederm.
Oh,
Radius.
Juvederm.
Yeah, those are fillers. That's
Oh, fillers,
different.
okay.
Yes, yeah, that's different. Those are for different purposes.
You wouldn't want to do a filler right in your glabella line because wouldn't it be too heavy there? Or
Well, it depends. Sometimes I do because this is a little deep.
Mm-hmm.
I like to see what Botox will do first, but then have you come back in a week and I might touch it with a little filler just to
Right.
smooth it out more.
okay.
Yeah,
That's
but for like forehead lines and the crow's feet, I don't usually use fillers there
Right.
because that's
Yeah.
gonna make it look lumpy.
Yeah.
Kim Neiman. Shout out to
Yes.
Kim Neiman, who's
Yes.
never had a thing done.
She's completely natural. Little sea breeze, just to help cleanse the skin. Got a little cold.
Do you want me to hold your hand, Tyler? I'll brace you against your.
You can do this. You
Okay.
can do it. I know
Don't
you
worry.
can. Okay, and then you're gonna get a little coldie pack, which has my name on it and a little
Oh.
mermaid in case you forget.
Did you used to be a mermaid in a different
I
life?
was. I always wanted to be a mermaid.
Mm.
See how you got a little tail on you right there. All right, and we're gonna just freeze that a second. It's a little cold, huh? All right.
Relax.
All right, and let me see angry, and hold the angry one. Little pinch. Relax. Angry. Angry.
Angry.
There. I want to see that muscle. I'm gonna put a little bit right in the middle.
Mm.
Done. Done.
That was no big deal, right?
No
He's
big
still
deal.
smiling.
So different parts of your body is probably more sensitive also, right?
Absolutely.
Yes.
And then a little cold there just helps relax that. Absolutely. Some people, this glabella area is a little more sensitive. Some people, the crow's feet are a little more sensitive. So let's do the forehead. And I'm very careful, if you inject too low on the forehead, you can get brow droop also. So I kind of imagine the equator of the forehead, and I always inject there or up, just to be safe. I'd rather you have a little line that might be left over than a brow droop.
Right.
Okay, so now I need you to do eyebrows up for me and hold them up. Little pinchy. Go. Little pinch. Relax a second. Eyebrows up. Open one more. There. Done. Relax.
Relax.
Not so bad.
Not so bad.
He's quiet.
Still smiling.
He's still smiling though.
It is.
Those beautiful teeth.
Yes. All right, so now here, I just want you to smile.
We're smiling.
Yeah. Little pinchy. Okay. Very careful again. That's why you want a board certified plastic
Yes.
surgeon, because you don't want to go too close to the eye. It'll give a little eye droop.
Or bruising, yeah.
Or bruising. Bruising can still happen
I'm
sometimes.
actually enjoying
Smile.
this.
Little pinch. Done. Okay.
Wow, it's a new you.
All right. Take a little cold over here. And so now for the next 4 hours, you want to keep your head upright, just like that. Perfect. You can't be getting all hot and sweaty outside.
No gym.
No gym for 4 hours.
Don't lift anything.
And then the Botox
No
is
cooking.
set. No
Okay.
cooking over a hot stove. So here's your
Do you
cold.
cook over a hot stove, Tyler?
I don't.
I never cook over a hot stove. There. So just dab a little bit and you are done.
Yay.
Yay!
Call board certified Dr. Royce and her friendly staff at 941 358 3223.
Nothing going on around here that hasn't gone on all year. Staying in day out and day in, wishing I was outside playing. Out and about, I got everything going.
Out and About Sarasota is a product of Sarasota Socialites.